Hi everyone, this is my second video and I wanted to talk a little bit about how my initial consultation went, and I have some stuff that I got from my consultation that I had on Friday. Today's Sunday. So I called and scheduled an appointment about 2 weeks ago, and the first appointment they had was Friday. So I took the first one that they had, and I really didn't know what to expect. She just told me to bring my insurance card, and I told her the insurance that I had, which is the Blue Cross PPO. So I brought that, and I brought some information for my insurance, but I ended up not having to show that or anything. So when I got there, they gave me a whole stack of forms to fill out. Probably, I don't know, a whole bunch of forms. Some just demographic stuff, medical history, family medical stuff. I've never had any surgeries before except my wisdom teeth removed, so that was just, pretty easy to fill out, and I don't have really anything that I know of right now. And so they were really quick. It may have been because it was a Friday before Memorial Day weekend, so everyone was ready to go home. But they had me meet with the dietitian first, and so I didn't know that I was going to be meeting with a dietitian at all. So she asked me a lot of questions, mainly about my history, because I didn't have all those forms filled out because I had about 5 minutes, and then they brought me right to the dietitian right away. So she asked me a lot of questions about my history and eating, and what kind of foods I eat on a daily basis, on a weekly basis, how often I eat out, if I drink like soda or sugar drinks, those kind of things, and a little bit about my dieting history, so what diets had I been on, how much weight had I lost from a diet before, that kind of stuff. And then she asked me some nutrition questions. It's kind of funny. She's like, what's a carbohydrate? That, and like, what's a protein? What's a sugar? And then we talked a little bit about what eating would be like after gastric bypass. So, she showed me what proportions would look like. She had little like plastic things of cottage cheese and carrots and stuff like that. So she showed me like what a fourth of a cup would be and how much, I'd be eating. And then, talked a little bit about water and how much water you have to drink a day. And see, that's pretty much it. And then she opened it up for questions that I had. So I asked her a little bit, since I'm 28 years old and, don't want to have a baby right now, but would like to in, 2 to 4 years, what she felt like would be, what would that be safe, or how would that affect the gastric bypass affect having a child in the future. So she talked a little bit about that. Of course, she said, as long as, you're having the right vitamins and stuff, and that they would be, of course, in touch with an OBGYN if, when I got pregnant down the road, if anything else came up. So, yeah, that was fine. It was probably 25 minutes talking with her. And then she said, okay, well, now I'm going to move you to, she moved me to this other room. It had like an exam table on it, a really small one, and had like a scale and 2 chairs, and that was about it. And this woman came in, I don't know, I think she was kind of like a nurse or maybe a physician's assistant, I'm not sure exactly. And basically all she did was took my weight and height. So she measured how tall I was, and then she put me on, it wasn't that fancy, but it was a kind of different looking scale, and it had a little like printout So I just stood on that, and I got a printout. She was really friendly and said that I could work on my paperwork while I waited for the surgeon to come in. So then he came in, and I waited for 10 minutes and finished up the rest of my paperwork. He came into the office, and he asked me to sit on the exam table, and he checked my breathing, and he had me lay down, and he just looked at my stomach, and that was about it. And then we went to his office, and he turned on his computer, and it had like my BMI stuff, and then he said he's basically wanting to know how much weight that I wanted to lose from gastric bypass, and what procedure that I was thinking about. And so he talked about the procedures, and he had this like little form thing that like has a diagram of all the procedures that he does. They do 4 different procedures, with the lap band, the Roux-en-Y, and then a couple others. And so we basically just talked about the 2. And I had a lot of questions. I could maybe the next time I post some of those questions and his answers. I think most of them are pretty common questions. I talked with him also about, in 2 to 4 years getting pregnant, and, what risk would be associated with that, and, because that's something that I definitely want to make sure that, wouldn't cause any harm to, my body to, be able to have a baby in the future. I had read this book, The Weight Loss Surgery for Dummies. It was recommended somewhere, I can't remember where, but they said it was a good read. So I knew, a lot about some of the things, but there were some questions that were conflicting, so I, asked a lot of different questions, and I wrote it down, the answers, so I could always go back and do another blog just about the question and answer session that I had with my surgeon. They've done like 2,000 surgeries, gastric bypass surgeries, and they do the laparoscopic, where they just make the small little incisions. They don't do it open. And so I was asking about, would you ever go to open, and what would, why would you, or, so we spent a lot of time talking about lots of different questions. And then we spent some time talking about basically the preoperative checklist, which gave me a whole list of all the things that are going to have to get done. So first, before they can even submit to insurance, I have to meet with the therapist or psychologist, and they have someone on site. So I'm actually going to be doing a phone consultation with them, not next week, but the week after. So they won't be able to submit to my insurance until that's done. And then he just talked about, all the tests that I would have to do before surgery. And so that was all pretty much that we talked about. It was very mellow. The surgeon was super, super, super nice. I told him I had spent a lot of time on YouTube checking things out and what book that I read, and he actually knows the doctor who was like one of the leading physicians who worked on that book, so it was good. And then, I have a whole long list of tests that I'll have to have within 6 months of the surgery, and then some that are like within 2 weeks. And that was about it. So it was really easy, nothing. I didn't know if I should stress out about it or not. I know that everyone's is a little bit different, but I just wanted to share what mine was like. So that's it for now.